Good afternoon. It's indeed a huge pleasure to be here, and I've listened to the last hour. And sometimes people ask, well, what do you need to get lucky? It's three things. It's always three things. First, you have to take risk. Instead of watching your smartphone in a meeting, you go to someone and say, I'm Koen. I'm going to Zurich. Where do you go? I dare to take the risk to talk to you. Maybe you're my next boss. Super simple. Rule number 2, I'm applying for a job with you, and you don't hire me, but I sent you a thank you letter. You will never forget that. Maybe in the future, you might need me. And the third thing is coming to your point, sharing. Very often people know something, they keep it for themselves. Share it. It makes you super powerful. And that's what I'm going to try to do. Share a number of kind of insights we gained the last few years in trying to build a dream. I have one dream. To build a world in which I no longer, in which you no longer, in which your kids no longer need to get sick. And I think we can try to co-create that together. By starting here. This came from a festival in Cardiff in Wales, before I die. And people were asked, what do you want to do before you die? 3 things, always. The first thing people always said, well, I want to leave some legacy. I want to leave a name, a company, a child. And look to this one. This is pretty cool. This is designed from Britain. This is, instead of burying me in a coffin, you bury me in a pot. And basically, I'm the seed for the next generation. And I try to build a first of buried people. It's putting it forward. It's planting a seed. This is number 2. No one wants to die alone. Never. You want to be part of a community. In Hawaii, being homelessness is a disease. There is a prescription to get you off the street and to get you a roof above your head. Absolutely basic. This is one of the few startups coming out of Google, which hardly anyone has heard of. It's called CityBlock. And what they do, they look to city blocks, and they try to build a community of people sticking together and putting it forward, sharing what helped them to live a healthy and happy life. So let's take that forward. This is a movie you might have seen. It's Wall-E. And this movie predicts or paints a future where this is the experience. We get diabetic, in a sense, and we watch screens, and there's computers or robots which come to us and basically fill the soda. So you could argue, why not? Because this could be a way forward, especially if we realize that we're currently able to start printing with 3D printers organs. We can make kidneys. And one of the things which happens when I get diabetic at the end, I get blind and my kidneys start to fail. So you could argue, well, live that life. We repair it. It's like a car gets broken and we get through it. The same with this. By the way, this is a hospital in Melbourne, which is the first hospital which has a biofabrication unit. They print organs in the clinic. Yeah? Now thinking about, well, that home thing. If you ask around worldwide, where do you want to die? Everybody wants to die, well, wants to stay as long as possible at home. Except in Japan. Japan is the most robotized country on the planet. And in Japan, people say, well, it's okay when we die in the hospital. Because we have things like RoboBear. This bear is my nurse. And this bear can take me out of the bed, put me in the bath, put me in a chair, and be my partner. There is not enough doctors, not enough nurses to take care of me. In Japan, I start to be able to deal with tech enabling my life. But that's just Japan, because look at this one. This is the only clinic on the planet which looks like every clinic from the outside. But from the inside, it's different. There is not one single bed. There is not one single patient in the clinic. Every patient is monitored at home with technology, BT-powered, where basically I trust as a physician that if I can monitor something from my patient, I can help him without him coming to my hospital and basically offering the very same services I need basically in the hospital. And think that through. When I get 85 years old, one of the biggest issues I have is that I forget to drink in time. It's hard to imagine, but when you're 85 years old, your brain forgets to drink. So one of the projects we did with a big team in Japan, we made a patch. A patch which sticks to my 85-year-old skin and which measures dehydration. Good? Not good enough. If I forget to drink, well, how can I interpret a patch? So we added a layer of electronics. And basically, we programmed the patch via IoT to communicate with my TV. Being 85 years old, I watch quite a lot of TV. And every 3 hours, my TV now tells, "Koen, go drink." That's something I cannot neglect. I've created health. I haven't prevented dehydration. I have it created by default. Yeah? This is the deal we have with a bottle maker in front, Vitello. And the caps on the cup, on the bottle, can be 3D printed. And we put a little tiny flag in it. And we have the bottle here sitting on my table, and ploops, a flag comes out. I know I have to drink. That's something I still manage to do. Invisibly, I've combined technology to change behavior. And this is something we test not in Europe, we're not there yet, but in Japan. We fly in a drone, and on the drone is a glass of water. That's not to neglect. That's creating health by default. And that's what I'm going to try to take you through. Very often, we see that you're fantastic in thinking about the future, but based on what you've been doing so far, you add something incrementally. And there's not a lot of people who are trained to think from an empty page. That's very hard, to think from an empty page. And nevertheless, that's sometimes what you have to do. Look to this slide. Who are you? I don't even have to know who you are. But I think you are the guy at the left. You're best in class in what you do. That's how you are trained. You're trained to be good in what you do. But try to be the right one, who's even blind and looks to something, well, he or she doesn't see yet, but which he or she might hope you can generate. That's what we're going to try to do. And it's tough. Let me explain why it's tough. Who sleeps 4 days a night, 4 days a week in the same bed? With the same partner? No, I don't know, no. You do me a favor. Tonight, you go to sleep 15 minutes earlier than your partner. Switch off the light, but you've taken the other side of the bed. Your partner will come in and will say, "Can you please move?" And now you're saying, "I'm innovating." Your partner will tell once more, "Don't be stupid. Can you please move?" And then you're telling, "I'm innovating. I've learned that at the Disruption Innovation Summit at BT." I mean, they never ever send you again to such a summit. Yeah? It's tough. And I think I haven't heard the stories this morning, but the reason why it's tough is this. 9,000 data points, big data, from football matches, penalties, where people have looked to a football player who has to play a ball in a 7-meter wide goal, kicking the ball from, I think, 9 meters distance, while there is a goalkeeper standing in the middle. How hard can it be? In 98% of cases, big data, 9,000 cases, the goalkeeper jumps to the left or jumps to the right. In 99% of cases, the soccer player plays the ball to the left or the right, which is stupid, because there is no keeper, normally. And why is it not happening? Because there's a 1% chance that I play the ball straight and you're there, and my reputation is gone forever. That's why innovation is hard. It's about not failure. It's about potentially losing reputation. And that's why I have good news as well, because innovation is not that hard. Innovation is doing what one of your superb artists, he's one of my favorites, Barksy, recently wrote. He took a quote from Picasso, and he made it his quote. And he said, well, bad artists, they imitate. The real good ones, they steal. I think you should steal more. Yeah? I did that as well. Look to this. I'm trained as a molecular oncologist, seeing patients, cancer patients, end-stage patients, ready to die. Till I went to China for the first time and learned that in some parts of the country, 2,200 years ago, the doctor got paid as long as people in the village remained healthy. How cool was that? Once you got sick, you not even had to pay. I cannot imagine something cooler than that, ever. Towards outcome-based medicine, that's the max you can reach. Now, to make one thing clear, we're all going to die. Dying is the best invention of nature, still. Dying makes you strive. If we wouldn't die, you could kind of do the things you want to do today, tomorrow. Never do that. Do it today. Yeah? But let me try to illustrate that. Imagine I sell you a watch, which tells you the number of days you still have to live. Who wants that? No one. But imagine I sell you this one. A watch where you can do something in your environment, in your lifestyle, to prevent the number going down, to stop the number, or even going up. Everybody. The day before you die, you still want to be relatively healthy. That's what you want to sign up for. Agree? Okay. So what is a big idea? We're going to die young, as late as possible. We're going to die young, as late as possible. Let's try to build that word together. This company didn't die, well, young. You know what happened here? Huh? It's because, why did it happen? Always people say, well, it's because Amazon came there. Well, partially true. This is Amazon 2018. Bookstores, physical bookstores. If you look to the Amazon bookstores, well, it's the experience with the digital interface of having something which tells what you normally read on the website, now physically in front of each book which is front-facing. Only a limited amount of books. If a book is out of order, we go and drink a coffee and they print the book. It's an experience. That is what digital is about. It's building experiences. It's removing friction completely. Rule number one is, if you don't want to disrupt, and indeed I agree with one of the former speakers, I don't like to disrupt, but I like something else. That is to delight. And delight is the ultimate experience, closest to magic, which is still real. What I'm going to try to take you through is building a world based on delight, in which I no longer need to get sick, and where removing friction is the first thing we're going to do. Okay? This is not perfect yet. But this was the first acquisition by Amazon, when they had announced that they were moving into healthcare. They bought a small company coming from a hackathon in MIT called PillPack. And PillPack sells you, no, they don't sell. Well, they bring you a small package at home at 8 o'clock with all the pills you need to take at 8 o'clock. And at 1 o'clock, they do the same. They bring you all the pills at home, physically, via lift, to get you all the drugs at 1 o'clock, and so on. So I don't have to think about taking my drugs myself. A community takes care for that. And I have a way to socially interact with the guy who's coming to me. Yeah? Which is one go of doing it. There is also a technical part of doing it. When I get old, there's a number of things which are hard. These are the first pills, which do contain a very tiny radio sensor in the pill. I swallow the pill, I digest the pill. When the pill comes in my stomach acid, it releases a radio wire, which sends a message to a patch on my skin, and the patch sends a message to my dad or my son that he took his medication or didn't. It's completely automated. I don't have to think any longer. It's basically creating health by default. And that is the first take-home message. One you have heard probably already 16 times today. The world is not about digital. The world is not about technology. The world is about building new experiences. Because remember, that is what people wanted to have before they die. 1, leaving a legacy. 2, being part of the community. And 3, I didn't tell you that yet, people never ever regretted the things they had done. They regretted the experiences they hadn't had. And that's a very powerful way for every business. Because I hope after today, you're no longer selling products. Maybe you're no longer selling services. But ask yourself, what if we sell delight? How would that look like? Yeah? And that is why I very often not advise to do this. Don't hire a chief digital officer. I once explained that to a pharma company which had just hired the chief digital officer. And he got the point, yeah? Because I added something to that. Because if you don't have to hire a chief digital, maybe you have to hire something else. This one. This is my birthday present wish list. And in yellow, if you give me something on my wish list, I'm happy. But if you give me something I even didn't realize I could get, That's in the green part. I'm super happy. An unknown unknown, something I didn't realize could be done, could be made, could be sold, could be whatever, that is delight. So what are you unknown unknowns you can bring to me as a patient, to me as a customer, to me as a father, to me as a child, knowing that 7% of companies think that they really reach, well, customer satisfaction. That's a fantastic opportunity to get it better. Okay, so how can I make it more clear now? I'm 65 years old. What is the biggest challenge I have when I go to a hospital? Who will take care for my dog? We have the first hospitals in Belgium now where we install the kennel. I take my dog to the hospital. 1. 2, the taxi comes and gets me. Lyft comes and gets me to the hospital. That's removing friction number 2. Number 3, waiting an hour in a hospital, I mean, it gets crazy. We hire music bands and they come play music. And the hour feels like 10 minutes. And at the end, we have to put someone on a Baxter. If the guy is 85 years old, while he's on the Infuse, we learn him to WhatsApp or Snapchat. He comes back home, he has a new experience to share with his grandchildren. The experience to go to that hospital is fantastic, really fantastic. And if it's a child, I have to put on an Infuse. Around the Infuse, I have a Batman or a Superman casket, and I sell superpower. Same product, different design. Delightful. I look forward to the next one where I get to the Infuse. And therefore, if it's so important that work seems to define part of who we are, the very first thing you ask when you meet someone is not what is your favorite whatever, or what is something you haven't told someone before. It's where do you work? So make sure that if work is that relevant, that you don't do things which become obsolete. I think delight will never become obsolete. And that makes it a very powerful way to look to that future. I guess this company, well, is a known company, right? Tesla. You know what the CEO of Tesla did a few years ago? He made all his IP open source. So everybody can use IP of Tesla to make electric cars. Why did he do that? Sorry?
Everyone starts copying.
For sure, sharing, yeah. Other reasons? He was building this, the biggest battery factory on the planet, in Nevada. The more electric cars my competitors start to build, the more batteries I sell. My question to you is, what are your batteries? That helps you to think forward. The car is a commodity. Something added to the car is no longer a commodity. And that's what I'm going to really take you through. Yeah? If I look to the real reason why we have lost that Chinese model of being healthy, this is the explanation. If you send a package from here in London to Berlin with FedEx or TNT or UPS, you go to a website and you can trace that package every 5 minutes, yeah? Which you find normal. My average patient is 8,700 hours a year by himself, not linked to the healthcare system. So a FedEx package is better off than my patient. That's not normal. And that is what you can change by introducing what I call guardian angels. I like the word, guardian angels. Yeah? And I think there's two guardian angels. And I'm going to show you a few examples. Yeah? Starting with one guardian angel where I fully realize it's very far away from your daily clinical practice experience, things you can put in your hands. But I think I should start with this because this is the biggest innovation or the biggest new thing which will enter your world in the next few months and years. And it's the revolution which stands on the shoulders of the digital one. It's the biological one. It's the one in which we, for the first time, are going to understand who you are. What the biggest present is you ever got from your parents, which is your biological code, your genome, your DNA, which defines, for a big deal, who you are.